Hello and welcome to the Bloodstream Podcast, a show serving the greater bleeding disorders community, brought to you by Believe Limited and Bloodstream Media, and made possible thanks to our presenting sponsor, Takeda. I'm your patient advocate and host, Patrick James Lynch.
And I'm your healthcare advocate, nonprofit nerd, and your other host, Amy Bradford, reminding you to please speak with a healthcare professional before making any treatment decisions.
Great idea. On today's show, we've got the NBDF CEO Phil Gattone on. We've got big news for Believe Limited.
Yes.
We've got big news for the community with a few recent therapy approvals and the latest I'm Fine segment with Michael Bishop. We have got all of that and, yes, even more on today's episode. Welcome to Bloodstream.
Listeners, thank you for joining us. And if you like what you hear, please share this episode with family and friends. You can share on social media, you can share on Facebook, you can share on all the things. And we would love for you to subscribe so you get this episode right in your little podcast guy without even thinking about it.
Don't even have to do anything manual. I'd also like to remind you, dear listeners, that the podcast, known as Bloodstream, is indeed made possible by our presenting sponsor, Takeda. Yes, that's right, Takeda. Takeda's got this website, may have heard of it, bleedingdisorders.com, where you can learn all about Takeda's resources for and commitment to the bleeding disorders community. Takeda believes in a world free of bleeds. Can you believe it, Amy?
We love that vibe.
And they're dedicated more than ever in their efforts to offer a wide range of programs and support to help patients throughout their treatment journey, wherever on that journey they may be, and you can learn more by simply visiting bleedingdisorders.com. One more time, that's bleedingdisorders.com. And for their founding and ongoing support of the Bloodstream Podcast, I would just like to say, thanks, Takeda.
Thank you, Takeda. I have to comment on your glasses.
Okay, comment.
Because
the jacket last week.
The
glasses now.
The glasses now, but like this is, I think this is legitimate because you're wearing glasses, you look super duper smart, and we're about to go into the new therapy approvals, which you always crush. I get the names wrong, I get the science wrong, so I'm just saying it's going to like really suit you to go into these like new things.
I feel so much pressure now. I was ready to talk about this, but apparently because glasses are on, I'm supposed to be a scientist all of a sudden.
Yeah.
Well, with that as my runway.
You're not a scientist, like a professor.
A professor? I could play a professor.
You're wearing a cardigan.
I am. I'm wearing a cardigan and some glasses. I'm also wearing pants. I don't know if you want to comment on those.
And you're drinking a LaCroix. I
am. I've got on sandals.
Because it's LA? Okay. I think you're going to crush this. So
there's two therapy updates that have both come about in the last few weeks and are interesting in and of themselves and indicative of where we are in hemophilia drug development. So the first from Pfizer. There is now an FDA-approved subcutaneous treatment called
Hympavzi.
We're not 100%, but we believe it's Hympavzi for routine prophylaxis to prevent or reduce the frequency of bleeding episodes in adults and pediatric patients aged 12 and older, adolescents.
But here's the kicker.
With hemophilia A without factor VIII inhibitors or hemophilia B without factor VIII inhibitors. This is a once-weekly subcutaneous treatment, and it's the first to be administered via a pre-filled pen or syringe for eligible people living with hemophilia A or B.
Is this the first treatment for A or B that's been FDA approved?
Of this tissue factor pathway inhibitor variety?
I think so, but nothing else works for hemophilia A and B that's
see.
FDA approved.
Yes,
right? Okay.
As best, yes, that is correct. This is the first one that is approved for either A or B.
So we're all in this together.
Without inhibitors, and we're all in this together.
To quote High School Musical.
It's also the first that is administered with this pre-filled pen.
Yeah.
So it's just coming ready to go. The target for this therapy is this thing called tissue factor pathway inhibitor. That is a natural anticoagulant protein, and its function is to prevent the formation of blood clots and to restore hemostasis. So we talk a lot about the desire to form a blood clot because when someone has hemophilia or a bleeding disorder, they're missing a protein that results in bleeding. However, The other side of the hemostatic system is the ability to stop blood clots from forming, because otherwise we would overclot. So there's basically a system of checks and balances within the coagulation cascade.
Which is in our body naturally, which is so cool.
Yeah.
Because if you think about it, the clotting cascade produces, a bunch of proteins. Like there's all these chemical reactions that happen when our body has an injury, and they just keep producing. And if we didn't have anticoagulants to kind of like level that out, all of us would overclot. Like our body wouldn't know when to stop. So our body has this natural checks and balances system, which is so cool. And science now, if you're a nerd about the science fair, like I am, we go into some of this stuff to try to teach these really, complex ideas kind of in a, hopefully like a digestible way, a fun way. But it's so cool how our body naturally balances itself. And these new treatments are fascinating because they're utilizing the entire clotting cascade and turning, to figure out like where we can modify, manipulate, just curve around to help us form adequate blood clots. So.
And while we've seen gene therapies before that, we saw the first MAB, emicizumab, a mimetic.
Love a MAB.
Love a good MAB.
I take a MAB for my migraines.
You love being part of the MAB club.
I do.
How's it going, by the way?
It's so great. My bleeders.
How's your MAB?
No, bleeders. The other day we were like, my Sharps container's getting full, and I was like, yes. Yep. Gonna have to get a second Sharps container, bleeders.
So relatable. So crazy relatable. So what's different, though, now is we have treatments that are targeting this anticoagulant part of the coagulation cascade. So we had factor replacement. Then we had the first mimetic, something that is designed to mimic the function of factor VIII in the coagulation cascade. Then gene therapy, which is still about the production of factor VIII proteins, ultimately, or factor IX proteins. Well, now we are seeing these therapies that are targeting the anticoagulating part of the cascade. So that's the first one from Pfizer called Himpavzi.
Yeah. I think that's right. I think you nailed it.
Thank you. I hope so. Also worth noting, it has received positive reviews from the Committee for Medicinal Products for Human Use of the European Medicines Agency, or the CHMP of the EMA, if you're an acronym fan. That's essentially the Europe equivalent of the FDA. Now, there's a second tissue factor pathway inhibitor targeting therapy that's also in late investigation approval stage. Now, this one's led by Novo Nordisk, and it's known as concizumab. This is also available for patients with hemophilia A or B without inhibitors, and it has just received a positive recommendation from the EMA's CHMP. Notably, however, last year concizumab filed with the FDA here in the United States, but was rejected, with the FDA requesting additional information around specifically proposed monitoring and dosing. The drug has since been approved in Canada, Australia, Switzerland, and Japan, and now has received this positive indication from Europe. It's also worth mentioning that concizumab has been refiled with the FDA. So the bottom line, this is news just in the last few weeks. Science is continuing to innovate the ways in which we can overcome deficiencies or dysfunction within the coagulation cascade. I think in the last year on the hemophilia A side of things anyway, we've seen the first gene therapy come to market, not necessarily the therapy we were all hoping for. I think it's exciting to hear about these things that have been working in the background all the while that are now ready to come out, and that may be the right treatment options for certain people. And I think a lot of folks don't realize how much has been going on because gene therapy has gotten so much attention. These rebalancing agents really haven't received the same amount of, airtime, so to speak. But as these recent approvals indicate, we're kind of ramping up in that new product class of therapies.
I agree. And just to make one small, not small, this is like a massive comment, but I do want to say that I need to go back. I should have come in prepared to see if any of these clinical trials included women in these trials, but it remains to be seen, I think, how some of these new therapies will work with a woman's body, with our different hormones. It is an exciting time with all of these new therapies that we get to choose what works best for us and our bleeding proficiencies and, how we want to live our life, the activities that we want to do. But I guess I'll just, state that for the record that we still have a lot of work to do in terms of like inclusivity in our community.
To put it mildly. So that's that news. Any other news we need to talk about before we get to the segments?
We have one bullet, and I think as the president of Believe, I think you should probably spill this one. Also, you're wearing your glasses.
True. Mainly for this moment. Picked out my best sweater and glasses
I know.
for right now.
I know. I wore a t-shirt.
You did. We really dressed up for the big announcement. We're very fashion focused people here. Believe Limited has officially joined forces or merged with a company called Brandstar. This is the result of about a 1.5 year long process of exploring various ways we could continue to grow and expand the ways in which we serve rare disease and chronic condition communities around the U.S. and globally. We've been speaking to the folks at Brandstar in particular for about the last 7 months or so. And long, detail-oriented story short, it is the right fit. It's the right complement of people, culture, capabilities, vision, ambition. And I think it's going to give us an opportunity to create a lot more impact across a lot more communities at a scale that we weren't going to be able to achieve on our own. So I'm very excited about it. It means a lot of change, and change is uncomfortable. We had actually a nice full staff meeting yesterday with the Brandstar CEO and founder, Mark Alfieri. He talked about this very thing of change is uncomfortable. And I'm hopeful that we may have Mark on here in the next couple of months to say hi to the Bloodstream audience, talk about Brandstar, why Believe. I don't know, maybe that's too inside baseball, but I think it might be kind of fun. Maybe as an end of show segment. Cool,
because I do want to say, like, it's a very exciting thing for Believe Limited from a business standpoint, from a vision standpoint, but our work and our bread and butter is not going to change. It's kind of the cool thing about this partnership in particular, and what we get set up to do. Like, we're really going to be able to, I think, take what we've done, especially in the bleeding disorder community, and really, give the type of advocacy, the awareness, and the education, and the media content, and kind of our bread and butter to other communities in a bigger capacity. So we're not going anywhere. We're excited to, keep bugging you people in the bleeding disorder community, suckers.
And we're now connected to the first and only television series on rare disease, a program called Behind the Mystery that's been running for, 12, 15 years, something like that on Lifetime. So continuing to expand the ways in which we're able to make an impact on communities. So that's our news. Believe Limited, now a part of Brandstar. Again, hopefully we'll have Mark on here in the not too distant future. But in the meantime, really, nothing changes. Still can hear Bloodstream just as often as you ever did. Same segments, same people, different glasses once in a while. Just depends on how smart I have to seem on any given day. With that, we will now move into our I'm Fine segment.
I'm Fine aims to challenge entrenched ideas around chronic resiliency and satisfaction with suboptimal outcomes by inspiring people with hemophilia to seek education and truly to consider the possibilities. Sanofi seeks to expand the idea of what's possible for the hemophilia community. So take a deeper look at the science behind hemophilia and an important connection between factor activity levels and potential activities at levelsmatter.com. Now on to I'm Fine with Michael Bishop.
Hey everybody, welcome back to another edition of I'm Fine. I'm your host once again this week, Michael Bishop. Today we're going to talk about community. It's something that we all understand is important, or at the very least, it's something that we've always been told is important. But like with all things, I think it's natural to question that importance at some point in your life. And so today we're going to talk specifically about self-alienation. I think alienation is something that every hemophiliac and rare disease patient generally feels fairly frequently. We feel it, of course, in our individual communities, probably because we're one of only a few hemophiliacs our peers have ever met and maybe will ever meet. But today I want to talk about self-alienation within the hemophilia community itself, in my experience with feeling it and having an impulse to do it. For those who missed last month's episode, I have severe hemophilia B with an allergy and inhibitor to factor IX products. Because of my allergy, I've had to use a bypassing agent since I was a child. I've actually only ever used the same one, and that's because there have not been a lot of options for me. This is thankfully in contrast with the rest of the treatment options in our industry and community. But my whole life, I've seen advancements in what feels like everybody else's treatments but my own. And with more sophisticated treatments comes a better quality of life. So there is a divide there, a growing divide, at least one that I perceived, between my quality of life and my peers' quality of life in the hemophilia community. You know, kids growing up now think about treatment only in the prophylactic sense, only in the preventative sense. And that's a wonderful, beautiful thing that I wish for everybody. But seeing the lifestyle that other hemophilia patients enjoy and overanalyzing the differences between that lifestyle and mine has manifested some resentment that I've had difficulty getting away from. Just as a quick story, I remember this one day in 8th grade. I had already had a major knee surgery, my patella dislocation and realignment. I had already fractured my tibia and fibula, and I had already had what feels like hundreds of knee and ankle bleeds. So all I ever thought about was walking without pain, like getting back to feeling like I could participate in life in the same way that everyone around me was. And it had been a long time since I'd done that. That major knee surgery happened when I was 9 years old. And so although that's not a lot of time realistically, when you're in 8th grade, 3rd grade feels like a million years ago. And so that's all I ever wanted. That's all I ever focused on. And one day at school, I went to the restroom in between periods. So I was late for music class, and I was walking down the hallway towards the classroom, and I realized that I wasn't feeling the steps that I was taking. The steps I was taking were not hurting. And I was overwhelmed with this feeling of gratitude and amazement, and I just wanted to walk. I walked right past the classroom. I went into the church that was connected to the school. I went to a Catholic school, by the way. And I just walked up and down the aisles and in between the pews until the period ended. I couldn't stop walking. It was the best feeling I've ever felt. It was something I'll always remember. And it was one of the last times I ever walked without pain that I can remember. Now, I remember sharing that story with other hemophiliacs a couple years later, and they understood it in a way that no one else in my life could. They shared similar stories, or they told me that they wished they had similar stories to share. And I guess that is to say, the reason I tell you that is because when I was young, it felt like everyone in the community shared a very similar struggle, a similar looking struggle. Like just hearing that someone else had hemophilia was enough information to assume that they were going to have or already have some pretty intense physical complications. And that's why being a part of the hemophilia community was so comforting. I knew that most other hemophiliacs would be able to relate to me in this way. As much as my friends and girlfriends and family members wanted to understand and tried to understand what I was going through, we all knew that they never truly would because they would never experience it for themselves. But hemophiliacs always knew exactly what I was going through. But now, with the growing divide between the quality of life due to gene therapies and other advancements in treatments, I sometimes feel like other hemophiliacs won't be able to relate to me either. Which, of course, is in many ways great. It is great. But seeing physically healthier patients communicate their successes, if it's done sloppily, or even communicating their failures because their failures look a lot different in mine, can make me and patients like me feel alienated within our own community. It can leave some of us in the corner of the room with our arms crossed, thinking, you guys don't know how bad hemophilia can get. And that sucks. It's honestly hard to admit that we even do that. And we probably don't even consciously do it. We certainly don't want to do it, but it's this subconscious reaction to what's happening around us. So when I started reflecting on this recently, it made me think of an essay by Audre Lorde titled "The Master's Tools Will Never Dismantle the Master's House." Now, I apologize, I'm going to get pretty English class with you, but I promise it's worth it. Audre Lorde was an amazing feminist writer, poet, essayist, and civil rights activist who worked and lived mostly in the mid-20th century. I think she died sometime in the 90s, in the early 90s. The essay I'm going to talk about today was published in 1984. To give a brief overview of the essay, it was a reflection on her appearance and presentation at a humanities conference at New York University. She was gay and a person of color and found herself relegated to those titles while at the conference. She was not asked to speak as a feminist generally. She was asked to speak as a gay, Black feminist writer. And she noted that limiting her voice to those areas mirrored this oppressive patriarchal system that her and her contemporaries had started a movement to fight against. Which admittedly made me think of all the times I was asked to speak at a hemophilia event, but it was the inhibitor section specifically. And I'm sure I thought rightly, because only a small number of people in that room at this already small conference were going to understand me. But honestly, I went into this essay assuming, because of experiences like that I was going to relate with Audre Lorde. And I wanted to kind of mine her writings for some way to fight back or at least thoughtfully analyze this alienation that I was feeling. But I left feeling both like Lorde and the people to whom she was speaking, which is when I realized how self-imposed this alienation that I feel truly is, and how things were kind of going the other way. I was alienating the larger hemophilia community from myself and patients like me. So here are a couple quotes from Audre Lorde that I wanted to share with you from this essay. She writes, "Without community, there is no liberation, only the most vulnerable and temporary armistice between an individual and her oppression. But community must not mean a shedding of our differences, nor the pathetic pretense that these differences do not exist." And Lorde also quotes the great Simone de Beauvoir, who wrote, "It is in the knowledge of the genuine condition of our lives that we must draw our strength to live and our reasons for acting." We are all still battling astronomical medical bills and insurance issues and chronic pain and joint damage. And the most valuable thing I could do is not alienate myself from other people in my community, nor other people in my community from myself. Because the truth is, our voice as a whole is the amplification of my own. Thank you.
Sanofi aims to raise the bar for patients living with hemophilia. Reimagine what's possible by visiting rareblood.disorders.com to hear more about Sanofi's dedication to the bleeding disorders community. Speaking about dedication to the bleeding disorders community, Phil Gattone stopped by. I guess I have said stopped by, virtually anyway, to catch up with what he's been up to in the last month or so since the National Bleeding Disorders Foundation's Bleeding Disorders Conference. I had no idea what I was opening up when I simply asked him, "What have you been up to since we last spoke to you on the podcast?" Turns out the answer is a lot, and you're going to hear about it right now. All right, I'm now joined by the National Bleeding Disorders Foundation's Chief Executive Officer and President, Phil Gattone. Phil, always good to see you. Nice to see you today.
Great to be with you.
So Phil and I chatted about bringing Phil onto Bloodstream a little bit more often so that when we spoke, it wasn't so much what's been going on in the last 6 months, the last year, but more so just the last few weeks, so that we could get a little bit more of a finger on the pulse with you and the foundation through you. With that being said, I spoke to you during BDC now about a month ago. Bloodstream listeners got to hear that. What has been going on with you and the foundation in the month or so since the BDC?
First of all, thanks for having me, and congratulations to you and the whole team on all the recent success, and congratulations on the merger with Brandstar. That's going to be an amazing partnership. And just want to say thank you for your leadership, Patrick. You have been a great friend to me and helped me get settled into this new role. And I just want to say thanks for that. And I will say after BDC, the excitement is still there for me. The kind words keep coming in, and I'm so encouraged by the experience that people had at BDC. We're really grateful for the participation and the support when we were together in Atlanta. And it's just carrying through right now. I've been really privileged to visit so many different chapters across the country and communities to learn more about the experience of living with a bleeding disorder, finding out what's happening locally. So that's really been my main activity this past month. And I've been in Iowa and in South Carolina and Texas and Nebraska, where not only did I participate in my first infusion clinic, but I also was part of their walk. And they had a guy there named the Pancake Man, who's been doing this for 39 years. And I caught not one, but 4 pancakes that he flipped my way well over 20 feet, the last one. So I've been involved in different community activities, but aside from all the fun things, it's been really meaningful to me to meet families, meet individuals. I've been in Nevada, and I've been at a couple of national meetings as well. I was in Michigan recently for a national women's conference, and it was so inspiring to see the leadership that's being shown, not only in Michigan with Sue Lurch and her whole team there, but the partnership with our national organization and communities around the country. And then I was also in New Orleans for the Hemophilia Alliance National Fall meeting they had. So I got to meet several leaders and people who are serving at HTCs around the country. And that was remarkable. I actually got to visit an HTC both in Charlotte with Dr. Paulette Bryan, who started that, and then also in New Orleans at Tulane. And Jennifer with the Alliance showed me around there, and what a great team and what an amazing resource it is for families to be able to get the care that they need in an integrated, coordinated way. So I was able to participate in the Alliance meeting. I've been having a great time learning and getting to meet some people.
How have you done all of this in the last month? You just named like 10 places. I saw you a month ago. Like how have you kept all of this up?
It was really planned, and I get fuel from being around people who are doing good work. I get inspired by the stories that people are sharing with me and the courage that they show each and every day. The real work, visiting, is logistically challenging sometimes, but that's not the real work. The real work is in the community. The communities are doing the work every day. It's inspiring to know that when you find out you have a bleeding disorder, you have an inheritable bleeding or blood disorder, and you need help, you need some information, you need some guidance, you need to find a community, because oftentimes you feel all alone. And it's so nice to know that there are people who have been down that road before, and that they're there to help, and they willingly and happily want to help. And when I see that, I really am inspired and energized by it. So I don't get worn down by this kind of work and travel. I get inspired, and I wish I could do more of it.
Listeners will probably be amused to hear, a couple of weeks ago, I went to the airport here in Los Angeles. I had a little quick trip to make to Phoenix. I had to get a bit of work done in the 30 minutes I had before the flight boarded, though. So I went to my gate, and I tried to find a little corner, and I found a corner, and there wasn't many people. There's one guy sitting there, also seemed like he was trying to pull away and do some work. And I'm looking at him from behind, but something seemed a little familiar. So I took a couple steps closer. I got partial profile, and I was like, is that? And then I heard his voice, and I was like, are you kidding me that Phil Gattone is sitting in this terminal right now?
Yeah.
So I went and sat across from him. He's in a meeting. I just waited for him to incidentally look up and see me, which at some point happened. And he was like, what?
Yeah, it blew me away. I could not believe that we both had the same mindset. We need to figure out a way to get so that we can hide and get some work done. And we went to the same little hole in the airport.
Same hiding spot.
Yeah. Amazing. I was on a call with my team, many of my teammates, and I turned the laptop around and said, guess you just walked up and said hello to me. So
hey, Peter. Hi, Christy.
Yeah. Yeah, it was also it was serendipity. It tells me that I'm in the right place.
Yeah, well, I guess they didn't tell you during onboarding, but any leader at the NBDF, when they come through LAX, they have to say hello to me. So if you don't prearrange it, I just show up
You
at your
find me.
gate.
Yeah,
Yeah,
absolutely,
it's just the longstanding tradition. You
absolutely.
mentioned the infusion clinic, and I'm guessing that's where I saw photos of you being infused. How did that come to be, and what was that like?
Oh, that was amazing, and I just want to say thank you to the Nebraska chapter, Maureen. Thank you so much for your leadership and helping so many families. What an amazing experience, Patrick. Walking in, seeing young people, people my age and everywhere in between, learning how to infuse, practicing under the supervision of amazing nurses and healthcare professionals who were volunteering their time to help. There was a young lady, first name is Clay, and Clay has a boyfriend who has hemophilia. And Clay wanted to learn how to infuse so she could help her boyfriend, which I thought was just amazingly loving and kind. And she didn't want to practice on her boyfriend. She didn't want to hurt him, but she was perfectly willing to try on me. So I was the guinea pig and happy to do it and learned so much in the process. She did great. She got my vein the first try, and we celebrated
Hey.
our big stick award. And the nurse who helped was just amazing and so kind. And it was an inspiring time for me. It was really a wonderful time, but it was also emotional because I started
Hmm.
thinking that so many individuals do this as a matter of course. They do this as a matter of their work, and I can't believe the kind of activity that you have to undergo to do this
Hmm.
regularly. So to me, it's just one little taste of what people experience on a daily basis, weekly basis, and I'm grateful for the opportunity and thankful to Clay that she got me on the first try. I told her 5 tries was the limit. Got it right
Wow.
on the first try.
That was a generous limit. I would have been like, if you feel anxious at all, we should just call this off.
Exactly. That's what the nurse said.
Well,
She said, it's 5 is a lot, Phil. Maybe 2. And I said, that's all right. Well, I wanted to take the pressure off, and Clay did great.
that's fantastic. And I will say, I didn't know you were going to do that. You certainly didn't have to. It's hardly a requirement of the post. But there is something connecting about seeing an image of you undergoing that experience, in that I see you not only undergoing something I undergo and therefore feel, oh, okay, we're a little bit more deeply connected now, but it's the fact you're doing it in the first place. It's the desire, it's the interest in, can I experience just a touch of what many that I now serve in this community experience? To me, that sends a signal that gives me great confidence that this is someone who's thinking along those lines. When I'm talking to him, when he's behind closed doors, when he's having just private thoughts and thinking about how to solve problems, I know you're thinking about me when I
Thank you.
see you do something like that. And so thank you for the courage to put your arm at risk.
Yeah, thank you for saying that. I'm so encouraged by those words. Thank you for that.
You're welcome. So we'll have Halloween come and go, and then we'll talk to you again probably just before Thanksgiving in the episode that likely will come out the day after Thanksgiving. So Black Friday, you can fire up Bloodstream, see what Patrick and Phil are talking about this time. What's top of mind for you in the next 4 or 5 weeks between now and Thanksgiving? What's
Sure.
going on
Well,
with you?
just real quick, 2 things. One is we're finalizing our operating plan and our budget for 2025. And I'm very sensitive to the commitment that we've made to our community. We have to live within our means. We have to be responsible and good stewards. We're a public trust. People trust us with their resources to do good work. So we're planning our budget and operating plan for next year. And as I do that, I just want to say that it's my hope that all of our national organizations around the country who are doing such good work in our community will take the time and invest the time to consider working together more closely, because our communities need the help. Our communities deserve the help. And I think it's up to all of us as national leaders to work together as efficiently and as effectively as we can. And I'm saying that with the added comment that the national organizations that I've worked with and the individuals who are leading around the country have been doing that. They have been very collaborative. They've been very kind to me. The spirit of collaboration and coordination is there. And so the environment is set for us to really leverage our resources to make a bigger impact together. And that's what I look forward to finalizing in the next 30 days or so. So when we talk next, hopefully we'll have kind of a final plan for 2025, and I can share some of the exciting things that are going to take place.
Well, there you go. You can anticipate at least one of my questions in a few weeks' time. So we'll look forward to that. Phil, thanks for, amidst all this travel and all this activity, carving out time for Bloodstream. I appreciate you, and I appreciate you coming on. Thanks, man.
You bet, Patrick. Thank you.
Thank you, Phil, and thanks again, Michael Bishop, for contributing to today's episode. Thanks, as always, to our presenting sponsor, Takeda, bleedingdisorders.com for more. And thank you to our I'm Fine segment sponsor, Sanofi. We could not produce this show without your support, and we are grateful for it. All right, Amy Bradford, our next episode comes out November the 8th. November the 8th. We got 4 left in the calendar year. What can listeners expect to hear?
Well, we've got 2 bleeding disorder community member luminaries.
An incredible use of luminaries.
I believe, Max Feinstein is going to stop by and talk about his surgery and his recent rehab, which is fantastic. And beloved executive director of the Nigeria chapter, Megan, is going to stop by and actually tease a little bit about some partnership between Believe and her organization. So we're kind of excited to have Max and Megan on the show.
Just partnerships left, right, and center these days. It's partnership season, apparently.
It's November.
It's partnership season?
Thanksgiving. I don't know. I made that up.
Thanksgiving's good. No, that's good. That works. We'll do that.
Okay.
Thanksgiving.
Vibes.
Well, with that is all for this episode. Be sure to subscribe to the Bloodstream podcast wherever you listen to have the next episode on November 8th delivered to you the moment it goes live.
And as always, mailbag@bloodstreammedia.com is that email address where you can email us all of your questions and your concerns. And if you have a story that you would like to tell on one of our podcast episodes or on a documentary film, or maybe you just think that it would be good for us to have your story in the back of your brain, something that you've overcome, a challenge that you've overcome, please email us at mailbag@bloodstreammedia.com. I always get that messed up unless I read it. Then you can social us too, like DM us on social. We'd love to hear from you and your story.
You can social us. Oh, I like that. You can hey, if you want to social me.
Because everybody gets it. Like,
you can social me.
You can social me.
Yeah, I'm on social.
I'm on social me. You can DM.
Social me. It's cool. Well, anyway, you can social me. I'm your host, Patrick James Lynch.
And I'm your other host, Amy Bradford, and you can also social.
And until next time, take self-care of yourself. Bye, everybody.
Bye-bye.